Hi, Assalamualaikum everyone. I'm Nusha Zimatika Zaman from Group 1. Now we would like to present to you about our chosen topic, which is diabetes awareness. So let's continue our slide. Our group members forms of 4, which is Nusha Zimatika Zaman, matrix number 206599. And next is Ahmad Mirza Alhad bin Anwar 20X 205 208055. And next is Afifa Nur Afifa Irisha binti Abdul Muid, which with metric number 206819. And last but not least is Iqbal with metric number 181804. Next, this is our content for our presentation for today, which is start with introduction, types of diabetes, cause of diabetes, sign and symptom, way to treat diabetes, ways to prevent diabetes, video about diabetes, summary, and references. Okay. Now I will start with the introduction. Diabetes is a disease in which blood glucose levels are above normal. Most of the food we eat is turned into glucose or sugar for our body to use for energy. Okay, diabetes occur when the pancreas that makes a hormone called insulin that helps glucose get into the cells of our bodies. And when we have diabetes, our body doesn't make enough insulin or can't use its own insulin as well as it should. This causes sugar to build up in the blood. Diabetes is the leading cause of adult blindness and stage renal disease and non-traumatic lower extremity amputations. It is also as a result of nerve disease. Okay. In diabetes, there are 3 types, which is type 1, type 2, and gestational diabetes, which all occur in pregnant women. Okay. All of which diabetes are characterized by high levels of blood glucose or sugar. Okay, this shows us the diabetes mellitus, a chronic disease that occurs when blood glucose, or also called blood sugar, is higher than usual. Diabetes is a non-communicable disease. Okay, in this diagram below, it shows the normal functioning of insulin, whereby food is processed by the pancreas, converted to glucose and insulin. Okay, this is for normal people. However, for diabetes people, the pancreas cannot produce glucose and the pancreas cannot produce insulin normally. Okay. Next, show us the diabetes in Malaysia. 1 in 5 adults in Malaysia have diabetes. That's about 3.9 million people aged 18 years and above. Okay, that's all from me. Now I will pass my presentation to Nur Afifa Irisha. Afifa?
There's 3 types of diabetes. So for the first one is type 1, insulin-dependent DM, which is juvenile onset diabetes may occur for 5% until 10% of all diagnosed cases of diabetes. So the next one is type 2 diabetes, which is non-insulin dependent DM. So usually adult onset diabetes may account for 90% until 95% of all diagnosed case of diabetes, and also weight gain and obesity. And then the next one is gestational diabetes, which is for pregnant women who gets DM and temporarily develop during pregnancy. So next slide. So the causes of diabetes. So what induces the type 1 diabetes? So type 1 diabetes happens as your immune system, your body's anti-infection system fight and eliminating insulin. And scientists assume that type 1 diabetes is triggered by the genes and environmental causes, such as the viruses that could activate the condition. And then for the type 2 diabetes, this is the most common form of diabetes. It may caused by the variety of causes, including behavioral factors and genes, where behavioral factor means about the lifestyle. Maybe the people, maybe they lack of activities or they consuming unhealthy meal plan. And then the next one is that gestational diabetes. The scientists agrees that gestational diabetes, a form of diabetes that occur during the pregnancy, which is induced by the hormonal changes in the pregnancy, and it's combined with the genetic and the lifestyle influence. So next. So this for the sign and symptom, uh, the person who infected by the diabetes usually have a frequent urination, excessive thirst, and unexplained weight loss, extreme hunger, and sudden vision changes, tingling or numbness in hands or feet, feeling very tired much of the time, very dry skin, sores that are slow to heal, and more infection than usual. So next. So okay, there's many more diabetes known as the symptom, which is just like I mentioned before, always tired, frequent urination, sudden weight loss, wounds that won't heal, sexual problems, always hungry, blurry vision, numb or tingling hand or feet, always thirsty, and vagina infections. So next.
So okay.
So,
Oh.
so I pass my presentation to Ahmad Mirza.
So okay. Hi and hello. My name is Mirza. So now I would like to introduce to you what is a type 1 diabetes with more elaboration. So first is uh, the type 1 diabetes usually occurs in the people that under age of 30. And the reason why it occurs is first is past viral infection. The second is genetic predisposition. So we proceed with the diabetes type 1 symptom. This one is specific. So first is irritability. You know when your head become sick, sudden weight loss, increased thirst, fatigue, extreme hunger, blurred vision, and frequent urination. Next. Okay. So this is the comparison between the healthy pancreas and the diabetes type 1 people, which is the healthy people can produce insulin and the diabetes type 1 cannot produce insulin. That's why occurs diabetes. Okay. So next, now we proceed with the diabetes type 2. So for the diabetes type 2, that occurs for the 10% of the world population. And the reason for it occur is the medicine, which is I think the excessive amount of medicine. So second is pancreatic disease. Third is stress, and the fourth is overweight. So all of these problem can lead to the heart attack and the stroke. Okay, this is the comparison between the healthy type people and the diabetes type 2 people. So you can see it also cannot produce insulin on their stomach. Okay, next slide. So now we proceed with the gestational diabetes. So gestational diabetes, which is I simplify say GM, which is occurs between the pregnancy mother, and 4% of pregnancy mother will occur the gestational diabetes. So 1/7 birth affected, and the reason for it affected is a high blood glucose level in the mother, brings extra glucose to the baby, and cause baby to put on extra weight. So what is the way to deal with the gestational diabetes? So first is monitor sugar level regularly. Second is eat right carbohydrates. Third is sleep well. And fourth is take prescribed medicine. Next slide. So this is a video, and on the PowerPoint presentation that we're going to send, you can press control and video, so you can open it on the Google Chrome. Next slide. So this is the way to treat the diabetes. Oh, it's spinning there. Okay, so for the type 1 diabetes, you can treat it with have a strict regimen with the insulin injection, usage of verapamil, implantable devices. For the type 2, you need to have some medication and personalized exercise routine, strict diet, and the glucose, which is controlling drugs, and the gestational diabetes, which occurs on the mother during the pregnancy. First is control sugar intake, light exercise, and insulin prescribed. So this is the infographic about the diabetes on how to treat it. You can see there is a blood pressure. So we need to check our blood pressure timely. Second is have a blood test weekly. Third is don't eat junk food. So take a proper diet. Fourth is take proper medication. Fifth is exercise. And sixth is prepare a schedule. Yeah, a schedule. Okay, next. So as you can see at the right, that is the common diabetes treatment. And what I'm going to share on this slide is about other treatment that effective to treat the diabetes, which is the home remedies for diabetes. So you can use a bitter gourd, like the step here, and the cinnamon, Indian grizzly, and other remedies like mango leaf, curry leaf, aloe vera, guava, and all of these herbal herbs very effective to treat diabetes. Okay, next slide. Okay, now I'm going to pass my presentation to Mama Iqbal.
Okay, hello there. My name is Iqbal. Okay, I'm going to present next about ways to prevent diabetes. Actually, there is a lot of ways that you can prevent diabetes. One of the ways is you can monitor and or lower your blood pressure and cholesterol. Second one is 30 minutes of activity per day, 5 days per week, or 150 minutes per week. It helps lowering the risk of developing type 2 by 58%. The next one is healthy diet. We have to eat a healthy diet which contain less fat, more fiber, whole grain, veggies, fruits, and also lean meat. And not to forget, we also have to quit smoking. Smoking is very bad for health. Last but not least, manage your weight and BMI. So at this slide, we only put 4 to 5 ways. So you can try and search and implement your ways of preventing diabetes. Next. Okay guys, before I play this video, let me tell you something. Do you know that Malaysia is the highest number case of diabetes in Southeast Asia for adults? Whereas for kids, Malaysia has the third highest number of diabetes cases in Southeast Asia. So this news is very alarming. So meaning that Malaysian people do not care about their health. So this is why Diabetes Awareness Month is developed. So let's play this video and watch together.
Hi, I'm Dr. Vindell Washington, Chief Medical Officer at Blue Cross and Blue Shield of Louisiana. It's November, which is Diabetes Awareness Month. 1 in 8 Louisiana adults is living with diabetes, and it's among the leading causes of death in our state. Diabetes prevents your body from making a hormone called insulin properly, which leads to high blood sugar. Over time, this can cause eye, nerve, or kidney damage and can raise your risk for stroke or heart disease. The good news is most people can delay or prevent serious side effects from type 2 diabetes by making simple lifestyle changes like eating nutritious foods, getting regular exercise, and reaching or maintaining a healthy weight. Make sure you know your numbers. Talk to your doctor about your blood sugar levels and family and medical history and whether you're at risk. It will help put you on the path to better health.
Okay, before we proceed to the next slide, if you see the video, the professor state that the Diabetes Awareness Month is in December. That's true. However, it has been changed to November after 2006 because World Diabetes Day is on the 14th of November every year. So, next slide.
Hi,
Sorry.
To summarize, diabetes is a very serious disease with multiple complications. Diabetes ultimately affect your blood vessels, which lead to more complications. Diabetes is common, but you can reduce your risk by losing even a small amount of weight. Be active with your care, with proper nutrition, physical activity, and regular food inspection. Lastly, create a new lifestyle defaults for your diabetes condition. Next slide. Okay, this is all of our references. These references are all trusted, as you can see here. First, Mayo Clinic. Second one is CPG, Clinical Practice Guideline. And then we have the WebMD. And last but not least, the National Institute of Diabetes and Digestive and Kidney Diseases. Next. Okay, we've reached the end of our presentation. Thank you all for lending me your ears and keeping your focus to our presentation. I hope that from our presentation, you can have some awareness on diabetes. That's all from us. Thank you very much.